And what are your thoughts on antidepressants? Because we look at the number of people who've been prescribed antidepressants in recent years and it's absolutely shot up. So what are your thoughts there on whether is there any utility at all? Is there, from what you've described, it's almost like there's more cognitive solutions out of things. So is there ever a time when antidepressants is appropriate?
Yes, look, I certainly think so. I think antidepressants are really overused. I will say that. I think sometimes it's used as just a go-to kind of treatment and overdone because, like say in our practice, we find that there's 2/3 of people with major depressive disorder who are on antidepressants and 1/3 who aren't. And the 1/3 who aren't, on average, recover just as quickly and just as well as the 2/3 who are, and also in a similar time frame. So I think antidepressants are overdone. However, we actually recommend that people talk with their GP about antidepressants if they're not on them, if they have a very severe depression or if they've tried psychological techniques and are not gaining much benefit from it. Or look, it could be also if people very much have an interest themselves or want to access antidepressant medication, because any treatment, including medication, works better if people want it. Now that might seem pretty obvious, but it's not as if all treatments work equally for all people, and someone actually wanting that treatment is a significant factor. So if someone wants it, or if they're severely depressed, or they've stayed depressed for a very long time or not responded to psychological therapies, then I think it is indicated. And what I see then is often antidepressants can benefit people, but I put it this way. It's like a body surfer catching a wave. The antidepressants are like a wave. It can give that potential momentum. But the person still has to actively use it, not just passively respond to the antidepressants and swallow it. The idea is for the person to, how can I make the most of this? And if the person rides the wave of the little bit of improvement in mood, little bit of the improvement maybe in sleep or tiredness or concentration, then actually antidepressants and psychological therapy can work very well together, because the antidepressants sometimes can give that little bit of a lift in mood, like a wave in a body surfer. And if the person responds to that little bit of a lift by doing things like the behavioural activation, like challenging their thinking, like getting their attention outward on things that give a sense of achievement or pleasure, then they work well together.